I can't imagine any member of Congress, I'm not aware of any member of Congress where there is a more positive, constructive, and effective level of engagement than what we have with Congressman O'Rourke. Our priorities, number one, clearly, get veterans off a wait list and into clinics. Number two, correct the systemic issues that have been identified in scheduling practices across VA. Scheduling is vital. It's the door to access for health care. We've got to get that right in VA. Third, to address some of the cultural issues that have surfaced that I think go toward the longer term solution here so that we're not talking about some of these same problems 2 years from now, 5 years from now, 10 years from now.
Let me begin by thanking the Secretary for being here. Secretary Gibson has been on the job for about 45 days. And the things that he has done in that time, including making El Paso one of the first VHA facilities that he visits, including moving this arbitrary timeline of seeing a veteran within 14 days to something more reasonable, still ambitious but achievable, which is 30 days, and including providing additional resources to poorly served communities and VHAs like ours. He mentioned over $5 million. And what that means in real terms is that if you're a veteran in El Paso and you've waited more than 30 days to see a doctor or a specialist or a mental health care provider at the El Paso VA, we will now have resources so you can go see that doctor or that provider in the community. If you are a veteran living in rural El Paso County or Doña Ana County, and it takes a long time to get into the VHA, and it makes it more difficult or even unlikely that you'll go get that care, we now have resources to connect that veteran to the care that they need. So I want to thank him for being here. He's no stranger to El Paso, but this is, I believe, his first time here in his new role as acting secretary. And I appreciate the fact that he's bringing resources, he's listening to us. We just left a roundtable that included our county judge, a county commissioner from Doña Ana County, a city council member, veteran service organizations, a representative from the Texas Veterans Commission, and many other stakeholders who gave them the same message. We are all here to support the VA, to ensure that it is successful, but its current performance today is absolutely unacceptable. And I join the Secretary in saying that the only thing worse than this crisis that we're seeing within the VA today is to fail to use it as an opportunity to make the necessary improvements so that we never have this crisis again. And the word that he used in our meeting today with stakeholders and just now at the podium, the very important word for a turnaround at the VA is accountability. When you have a VA here in El Paso that we have learned is the worst in the country out of 151 facilities for access to new veterans seeking mental health care, when it is the fourth worst in the country for returning veterans seeking mental health care, when it is the second worst in the country for veterans seeking specialty care, there have to be some kind of consequences to explain this perennial poor performance of this VA here. When you have veterans telling me at town hall meetings that many of you have been at that they've called the VA and they can't get an appointment, or they have an appointment and that appointment is canceled by the VA but shows up on their medical record as a no-show, which counts against them and doesn't count against the VA. When you have veterans tell me that they can't get into the VA at all to seek mental health care at a time when we have 22 veterans a day taking their own lives. And when we've heard stories like those of Bonnie D'Amico, whose son Nick D'Amico could not get in, and heard these stories at a veterans town hall from older veterans who were having a hard time coming in and took his own life 5 days later. You know that we couldn't have a situation more critical and more important to turn around, and key to that turnaround is going to be accountability. So what I've asked the Secretary is, while we're grateful for the new resources, while we are grateful for his visit, we, this community, the veterans that I represent, are owed an explanation for the poor performance to date. We're owed an explanation for why we were not told and why we had to find out at our own expense through our own efforts, through a survey that we conducted, to finally find that 37% of veterans couldn't get in to get mental health care, that we had wait times that were well beyond what was being reported in the El Paso VHA. If we do not get that accountability, if we do not get those kinds of answers, if we don't have people stepping up to take responsibility, and if we do not have consequences this crisis will have gone to waste here in El Paso. And so as the Secretary tells us that he sees a VA in 2 years from now, where we look back on 2014 and we're amazed at the turnaround nationally, at the long wait times that have become short wait times, on quality of care that every veteran can depend on numbers that are released by the VA that everyone can believe, I tell him there is no better place to start that turnaround than here in El Paso, Texas, given our bottom of the barrel performance in almost every single measurement that we care about. So whether that means ultimately a full-service veterans hospital, whether that means additional resources to hire more providers, whether that means that there are consequences for the leadership here at the VA today, whatever that means, we are expecting results. The Secretary knows that. He's committed to working with me on that, and I have committed to working with him and the VA to make sure that they have the resources and the support from Congress to get that job done.